This is Christopher McGrath, and this is our technical presentation for the Contraceptive Pro. This slide contains a link to the narration of our presentation. The Contraceptive Pro gives healthcare providers a quick and easy way to give targeted health information of risks toward patients interested in using contraceptives. If the recipient is a candidate for contraceptives, our application will display a CVS card to the healthcare provider to access our app. Our Smart on Fire app will match patient data against the MEC guidelines to display a risk analysis for each contraceptive. On the left, we have an example of the CVS card in JSON format, and on the right is what the healthcare provider would see when starting our app. The card will appear if the patient is female and in between the ages of 18 and 45. This data is automatically collected. It will then ask the healthcare provider if the patient is interested in contraception. Clicking on the CVS card will launch our Smart on Fire portion of our app. Once the CVS card is clicked, our application will automatically pull patient conditions data from a Fire server and compare it against MEC guidelines for health risks. The current slide shows a mock-up of what the healthcare provider will see after clicking on our CVS card. The condition and subcondition will also contain links that will bring up more information on that particular condition or subcondition.
Hi, this is Eric Rankin. I'll be going over the architecture diagram for you here. First, we start from the EHR, and when a patient record is opened, that's when the CDS hook determines, based on prefetched data, whether that patient is a female aged 18 to 45. If that patient qualifies for that, the JSON is returned for the CDS card, and there's a link provided for the Contraceptive Pro app. If the doctor chooses to click that app, that's when authentication, the OAuth authentication happens, and then our app begins querying the FHIR databases to determine what that patient's conditions are. Once we obtain those conditions, that's when we match with the CDC's MEC guidelines to determine what the risks for different contraceptives are. And as you saw earlier in this presentation, that's when we present the chart that shows the risk factors for those different conditions. The tools and languages we'll be using are as follows. Our primary language is going to be Python, and within Python we're going to be using the Flask framework for our backend APIs, as well as Flask with a combination of Jinja 2 templates for our front-end views. The production web server we're going to be using is Nginx. The containerization will be Docker, and then the CI/CD will be Jenkins. In terms of risks and mitigation strategies, we have several risks. First is the authentication of the doctor, and we're going to discuss with our external mentors what their preferred method of dealing with that is. We're still unsure if the EHR is actually providing that authentication or not. So initially we're expecting to be using a token authentication scheme. Overloading the application with too many conditions or subconditions was a factor, because I think there was about 193 that the CDC provided in their MEC guidelines. So we're going to be working with our external mentors to use a limited set of those conditions and subconditions. And then finally, the risk that a condition simply isn't found in our database or it doesn't match with anything. And what we're going to do is add a disclaimer to the application to seek further information if a condition is not found. As you can see, we've decomposed. As you can see, our Gantt chart is now spanning 2 slides because we've taken some time and decomposed some of our earlier tasks to make them less general and get more specific, more granular with the different tasks. As you can see, we've decomposed. As you can see, our Gantt chart is now spanning 2 slides because we've taken some time and decomposed some of our earlier tasks to make